This is pursuant to the North Carolina General Statute as noted in the agenda, which is 143-318.12B3. First item on the agenda is the adoption of the agenda, and you have the agenda in front of you. Do I hear a motion that we approve the agenda as presented?
Make a motion, we approve the agenda as presented.
Is there a second?
Second motion.
Thank you. All those in favor say aye. Aye. Any opposed? And motion passes. The next item on the agenda is for the board to go into closed session. Do I hear a motion that the board go into closed session?
Chairman Pennell, I move that we go into closed session to discuss confidential personnel matters pursuant to the reasons listed on our current agenda.
Okay. Is there a second? All those in favor say aye. Aye. Any? Motion passes. The board will go into closed session. We don't figure it's going to be very long, but we'll be back as soon as we possibly can. There may possibly be action afterwards. We'll be back to it. Order. This time, I'd like to recognize our superintendent, Dr. Don Fitz.
Mr. Chairman, the podium, Mr. Chapter. Appreciate you all being here and having an opportunity to present and share some information. What I want to do is to give you an update. As you all know, we're at the end of our first grading period, and we have a remote learning day tomorrow, and then when Monday comes, we'll be at the beginning of the second grading period for our school system. We're in the midst of a topic that generates a lot of opinions. There are a lot of perceptions, there are a lot of ideas, there are a lot of perspectives that individuals have. And it puts our board in a difficult situation. Anyone else who's having to make a decision that affects the lives of individuals is difficult because it's impossible to make a decision that pleases everyone or folks fit in and agree with what we're doing. You all know that we're dealing with difficult times, unprecedented issues and obstacles and hurdles and decisions that have to be made. Throughout the course of the work that we've done, we've tried to focus on the safety of students and adults, and you'll hear that today. I want to share some information with you, but I want to focus on our students and our adults when we're talking about our school population. We have sought daily guidance from our partners. Anna is here from the health department, has been a tremendous resource to us, the personnel and the health officials from UNC Caldwell, other members of the health department, our school nurses, the faculty and staff of CCC and TI have been partners with us as they're going through in the same county, obviously, that we are dealing with education and service delivery, just to be able to share ideas and talk about what situations we're dealing with and what's working well for them and how we can improve practice. You know, these things are very important, and we deal with these on a regular basis. But tonight, what I want to do is accomplish three things. I want to be able to share some Caldwell County Schools data with you to give you a picture of exactly where things are for us. I want to address our current status. That would be the status of where we're at on our back to school plan and where we are today. And then discuss future operations in light of current local trends. And the reason I think that's so important, there are a lot of concerns that folks have raised to you and to me and to others about what our local data is. And you all know if you're following it, many folks are following that like a scoreboard every day at the number of cases that are reported, that we've seen an increased number. But I want to dig a little bit deeper into that, and I think Anna will talk about that some too. So I want to start off just with data. And the data that I want to share with you is through October the 14th. And this is data for us that I'm going to talk about is for the 2021 academic school year. So when school started for us on August the 17th, looking at our data going through yesterday is the last reported data that I have included in what I have. So that's a 9 to 10 week time period, depending on if we're talking about our Applied Sciences Academy and the early college high school. And I'm gonna leave where we're at right here on the PowerPoint, and I'm gonna come back and reiterate the points that I'm making here if we feel like we need to do that. We've had to be very careful when we talk about data from a school system perspective, that we don't release any data that allows anyone to be able to discern the identity of an individual. So we don't want to release data that would let a person know that a particular student or particular staff member at a school or in a department or another building location is a positive COVID patient. And we've worked very hard to do that. But what I want to share with you are some overall numbers that we have. And I want to stress that any number other than 0 is a concerning number for us. And that's where we want our numbers and our counts to be. I also want to stress that when we talk about student positives, that on the day that school opened, on the 17th of August, we had students at that point that were positive because of activities that they were engaged in outside of school. And almost all, if not all of the cases that we've talked about, students and adults, are cases that when you track back where the contacts were, they've happened at places other than on school campuses. So we feel good about that. But our total number of student positives since the school year started is 69. That's across all of our grade levels. That's for every day over a 9 to 10 week time period. And again, those are some cases of even students who had not set foot on a school campus because at the beginning of the school year. When you take a look at our overall student population, and I've reduced that number to 8116 because that's the total number of students that we have in face-to-face instruction right now, it's less than 1% of our student population. It's 0.85 is where that number is. And again, I'm not celebrating 0.85. I'd really like to celebrate 0. but I want to put in perspective where we are and frame that number for what it really means. Over the same time period, and that would be from the beginning of school until yesterday, we had 12 staff positives. And 12 includes teachers, it includes anyone that works up here at the Ed Center, any department, office, anybody that we've got a substitute teacher, anybody who's a staff member of ours. We've had a total of 12. And that represents 0.67% of the total population of individuals that are Caldwell County Schools employees. And again, below 1, we're not happy with any number that's other than 0, but it's a low number when you frame it and put it in perspective. When you talk about averages, and you know averages change from week to week, but if you take a look at our numbers and you just divide the number of positives by the number of weeks that we've been in school based on 9 weeks, using that as our number, we're averaging 7.7 students per week. We're averaging 1.3 staff members per week that are coming back testing positive for COVID. So, we have said that you can count on one hand or two hands what we're really dealing with in terms of new cases in any given week. Those add up as you do the multiplication over a course of a series of weeks, and that's where you get to your number. Our quarantine process, and this was guidance that we received from our health department and other medical officials at the state level, but really what we're doing in Caldwell County comes from the health department's guidance. Our quarantine I feel like has been one of the secrets in terms of procedures and processes that we follow that has helped us keep the numbers down to the number where they are. We've seen an increase in the last 2 or 3 weeks in our number of quarantined students and adults. That shouldn't be surprising if you're following what the county numbers look like. We've seen the numbers go up at that point as well. But I would say that we've not seen the kind of spike inside the school system that we've seen around the county. And I want to share some of those numbers as we go through too. The quarantine process for us has worked, and we certainly will continue that as we go forward. Every day we have students and staff members that are coming off of quarantine, and every day we potentially have students that are going on to quarantine. Something else that we're doing every day in our schools is what we call an isolation. And isolation is if a student comes in and they're symptomatic and they're showing any of the symptoms of COVID, we have them in isolation. We have school nurse work with them, and we don't allow them into the student population until they've gotten clearance and we know that they're medically okay to be back in the classroom. This may be a practice that we want to look at as we move forward when we start talking about the onset of flu season and things like that. I feel like we've kept students that may be a danger in terms of spreading illness to others out of the classroom because we've had them in an isolation area and had them go home. And we feel like that's another impact that we've had that's kept the numbers down. We feel like our cleaning and the protocol of wearing face masks and the hand washing and the social distancing and all of those things that we talked about before school got started, we feel like it helped us get to the point of where we are. Protocols, processes, procedures, and routines, we feel like have been successful. They've worked for us, and as I put this in perspective, comparing our school system numbers to the county in general, I feel like folks will realize that our school system certainly is a place that's a safe place to be. And as parents are looking potentially at sending upwards of 400 students in on Monday that haven't been in school, we want them to feel comfortable about what we have in place. Our current status, as we talk about that a bit, you all know that we're operating on Plan B. We have 2 options with students that are in Plan B, which is really a hybrid that we're calling it. They're in school on Monday and Tuesday and doing remote learning on Wednesday, Thursday, and Friday, or they're in school on Thursday and Friday and they're a part of remote learning Monday, Tuesday, and Wednesday. And then we have another group of students that are completely remote online in a program that we're calling Caldwell Connect. But we voted fairly recently after the governor's allowance to do so that we were going to move into Plan A. And that Plan A movement would take effect on October the 19th. This would impact kindergarten through 5th grade only. The governor did not give us an allowance to do anything middle or high school, does not give us an allowance to do anything for students in a K-8 school beyond the 5th grade. So what we're talking about doing with Plan A is being back in school 5 days a week, and it only involves kindergarten through 5th grade. But we've said that through the month of October, we would maintain those 2 cleaning days on Wednesdays, continue to have that operation. So that's what our plan is. Again, I feel like our protocols, the process that we put in place, the guidelines that we've had, and what I hope now are routines and regular behaviors have been successful. We have adequate supplies of cleaning materials and PPEs that we're using and will continue to use. We'll continue to operate with the safety measures in place, and we'll continue to monitor the data as we move forward. The greatest concern from an operational standpoint And this is from my superintendent's perspective. And I think if you were to talk to the other 114 superintendents in North Carolina, they would tell you the exact same thing that I'm getting ready to say, that the greatest impact that we have in terms of our ability to operate on a daily basis right now are the number of staff members that are in quarantine. And that can potentially be a looming problem for us if more and more staff members become captured in that quarantine web. And what that means is that we may not have the individuals available to do what we need to do, and then we have to make some decisions. But at this point, we've been able to work through that process. We have not had any situations where there's been any kind of a void or vacuum created in terms of safety. And we're working with substitutes, and we're working with different assignments with individuals. But as we move forward, you have some departments that are relatively small. We have some schools that are relatively small as you compare those to others. And if you have a handful of individuals that wind up being quarantined, it has a greater impact on our smaller schools and our smaller departments. And that in turn may have an impact on what we're able to do in terms of service delivery. So I'm going to say this a number of times. What I'm telling you tonight is true for right now. And things may change tomorrow, and they may change next week, or they may change next month. And if those things change and we get to a point where we feel like we can't adequately provide services that we're expected to provide, then we'll be back with you and asking for some other guidance and looking at some changes. Next week, I want to stress to you all and to our public, will be like the first day of school all over again for our elementary and our K-8 students. And the reason for that is we're going to be in school 4 days, eventually getting to 5 days a week. We're also going to have bus routes that are going to look a little bit different than they have because we're having to put additional students on the buses. And I would just ask for patience and tolerance from everyone involved in that, because any year you have buses that are a little bit out of schedule. We have bus routes that have to be tweaked. We may have to determine how to move students around to make sure that we're meeting the guidelines. But we'll be operating under Plan B for buses right now. And we'll continue to do that until we have the ability to make a change or a need to make that change. And we'll be working with the health department as far as that goes. So as we work on that, it's in some ways going to be like the first day of school all over again. There'll be more students on our campuses. There'll be more students in our classrooms. There'll be more movement in the hallways. There'll be more students going through the cafeteria line. All of those things are going to change as we have more students coming in. So we ask for the patience and the grace as we work through that. And this is just different than it's ever been before, because we've never had this kind of an opening in the middle of the school year in the middle of a pandemic. And we're working through all that. The good news, as I think about it, is the majority of the students that are going to be coming back on a regular full-time basis are students who have been with us, the majority. There'll be a few new students that have to learn routines, but they'll pick up from their peers. And if the students that we've had in school for 9 weeks are any indication, those students are going to pick up those routines and behaviors and follow without any difficulty at all. And the last thing I want to talk about is our community data. Caldwell County in particular, you all know, has seen recent increases in positive cases. And we watch that, and we celebrate when the numbers are going down, and we optimistically hold our breath that they stay there. And then we have concern when the numbers go up, and we want to make sure that we're doing our part to help contribute to the positive direction of numbers and not the negative. And I know you can make data say anything you want to say, and I know you can present numbers in different ways, but I want to share with you the numbers that I've looked at and what I wanted to try to convey in terms of a message. When I hear folks talk about the concerns, and again, when we talk about school safety, we're talking about student safety, and we're talking about adult safety of the individuals that are in those buildings. And it's important to me that our staff members are cared for and they're taken care of, and that we don't put them in situations that are harmful and have issues that we need to address. We want to make sure that we do those kinds of things. But when we analyze our data, we feel like our processes and protective measures have been successful. I want to tell you why I feel that way. I went back and looked at our number of positive cases for our students or for our children. And the data that's reported by the health department is not reported they're reported in 3 ranges of student ages, from 0 to 5, from 6 to 11, and from 11 to 18. We don't have that data reported by the health department by schools. So we don't know out of a 6 through 11 area, when we see a number, those students can be homeschooled. They may be a part of a private school. There may be any particular situation where they are. So when I talk about numbers right now, I'm talking about county-wide numbers. And if I'm talking specifically about Caldwell County schools, I'll let you know that. But the number of positive cases in our county has increased when you're looking at children aged 6 through 11, And I'm looking at a month window of time. And the reason I wanted to pull out a month period of time was because looking back from October the 14th to September the 14th gets us 2 benchmark periods in time. And we could have looked at individual days, but I wanted to look at what happened over the period of 30 days or basically a month and what that looks like. And when I went back and looked at what was going on in our county with children between the ages of 6 and 11, and these are not necessarily students of ours, but these are children in Caldwell County, the number has increased by 7 over that month. And I think most folks would think that number would have gone up a lot higher more rapidly because of what looks like spikes when you look at the graphs. And if you take a look at the number of students ages 11 through 18, again, these are all children in Caldwell County, not all Caldwell County students. That number over the same period of time from September the 14th to October the 14th has increased by 52 in our county. So if you take those two numbers and you add them together from 6 to 18, that number has gone up by 59 in our county over a 1 month period of time. But when we examine the number of students in our school system, these are Caldwell County school students who have tested positive over the past month, the same period of time from September the 14th to October the 14th, that number is 37. It's much lower. To me, that's good news. And any indicator that's in a positive direction, I certainly want to be able to highlight that. 37 is 37 more than we want. But 37 is the number that we have during this period of time where we've seen the spikes. So the pattern that we look at resembles the county trend, but not to the extreme in terms of the numbers. But it's certainly something that gives us a picture that we need to follow. So then that points us to the rest of the population. And for my conversation with you, that would be the population of 18 years of age and older. In that population, there may be some 18-year-olds in our school system, but there are other 18-year-olds that aren't for a variety of reasons. And then there are students and people in our community that are much older that aren't affiliated in our school system at all. So if you take a look at the 20 to 65 population, as you know, that's where many of our teachers and staff members are. And that's where the numbers have to be if we're talking about spikes and large numbers and the numbers aren't showing up in the age ranges that I mentioned to you before. I've said before, we want to ensure safety for students and staff. And the data indicates that over the last month, there have been 429 individuals in our county that have tested positive who were 18 years of age or older than 18 years of age. 429. That's over the last month period of time. Same time period that we're looking that I've talked about before. September 14th to October the 14th. Out of that 429 adults is what I'm going to call them, 8 have been Caldwell County School staff members. 8 out of 429. So that means out of the positive tests that have happened in our county over the last month, 1.82% have been employees of Caldwell County. Now, again, I don't know what that number means to you. I don't know how that speaks to you. What it says to me is that the numbers of individuals in our school system are not well represented, and we don't want to be well represented in that group. And I want to believe that it's because of the protocols and the procedures that we have in place. I also hope that what it means is that as our individuals leave the workplace, they're following the guidelines that we're practicing every day in the work environment. And that would be how they interact with individuals out in the public and where they find themselves and how they handle the behaviors that we're doing at work. And I think that helps keep the numbers down because that's what we really want to continue to work to look at. But I want to stress, if nothing else, that of the positive cases that have been contact traced, most of those, if not all of those, have been contact traced away from school. And they're contact traced to family members, to spouses, to children, to individuals that they have contact with in other ways. And we want to believe and we want to continue to practice that the quarantining that we put in place, when we know that there's a positive case and we know who the close contacts are, that those individuals go into a required quarantine until we go through the quarantine process. We truly believe that this has helped keep the numbers down. And that isolation that I mentioned earlier with students and other individuals with COVID symptoms, we feel like continues as well. Everything that I share with you today, as conditions warrant, everything that I share with you today is true today. And you know that anything could change tomorrow or next week or down the road. And as conditions warrant, we're going to come back. Looking ahead, it's impossible to predict what will happen. Positive cases and quarantines will have different impacts on us, again, because of what we're talking about, departments and areas that have different numbers. But I'm going to ask Anna, if she would, to to speak to just the information. Anna's working with us on what our data looks like. She's working with us on what our procedures and protocols are like. We've called her many, many times and asked her if certain things were done appropriately, or we've got situations that are coming up and what guidance will be provided. But Anna, I guess for the board's sake, what I'd ask is from your professional expert opinion as we move forward. And our plan is to go to Plan A for our youngest students, our elementary students, on Monday. Are we still good on that course? And what advice would you give us as we move forward? So I want to turn it over and publicly thank Anna for her support and work over these past few weeks.
Thank you all for letting me come and speak tonight. I want to echo what Dr. Phipps said. Everything is in this moment, in this time. I'm here tonight to clarify any questions and answer questions, just give updated information for you. So here's where we stand at this moment, just like what he mentioned about the data. Everything in this time moment stands today, but it could change later tonight, it could change tomorrow. Everything with COVID keeps changing. So total positives we have, and this is from the beginning, all in Caldwell County, we have 2,084. Recovered, 1,188, and active, 866. The ages broken down, and this is what he was mentioning, 0 to 5, 6 to 10, and 11 to 18. Ages 0 to 5 is 65 cases, 6 to 10, 60 cases, and 11 to 18, 194 cases. Some more data that I've collected is there has been an average of 29 new cases per day, which is that highest average daily cases in October only. The majority of the cases we have seen recently are in the age range of 25 to 49, with an increase in ages 50 to 64, as he mentioned as well. My concern with the increased numbers in the age ranges would be the staff at this time. That kind of goes back to his data that we were talking about earlier. We have a few clusters in the county and different organizations in which none of those are schools. All staff, students, nurses, and administrators have done a tremendous job, and we can't thank you at the health department enough for that with managing COVID within the schools. There's been continuous work, calls, just things that we've had to juggle, I guess, from the beginning, and different things we've had to change just to make things work. And as he's mentioned, everything has been working, and we say kudos to you guys. You've done a fantastic job. Everybody has. So to keep this going and to, if this is what is decided from you to go into planning, there's some things that may have to keep continuing. So we may have to quarantine more students and more staff, just as he remembered, or he said that if we quarantine more, there's going to be less positives. That is our main goal. You know, if we have more people out, there'll be less exposure, less risk. So there is decreased social distancing with Plan A. So that might be something we have to look at as well. We may have to quarantine more students. We look at the staff, be more vigilant on isolation measures. That is if staff, students are showing symptoms at school. And then cleaning and making sure everyone is wearing correct PPE, not just having their mask or just having gloves, making sure it's the right kind and wearing it correctly. And if you maintain current measures, this should decrease the risk. And this is something else that's just been kind of going on with our current clusters and outbreaks. But I highly recommend and stress continuing doing the 3 W's, wear, wash, and wait, as you've heard many times since this began, outside of school. And I think Dr. Phipps even just mentioned that as well. When we go home, this is what we need to do. A lot of our cases not related to our current clusters and outbreaks may be simply from people attempting to go back to our old normal. That's something that we want to do, is go back to our old normal, but this is our normal now. And that's something that we need to really think about, is the wear, wash, and wait. So this is just an update that I have from the health department. I don't know if you guys have any questions for me.
Any questions?
And I will ask you a question. I was trying to keep up as you were doing this. From 25 to 49, in that last part that you talked about, that age limit, that was, those were the clusters, but they were not in school. And then you said something to 54. What was that? Can you clarify that?
Sure, ages 25 to 49 and ages 50 to 64, we saw an increase.
That was the increase, but it was not school related.
No.
Okay, that's what I want. That was the greatest increase. Thank you.
Here lately with our increase in numbers, it's not been the school age children, it's more been the 25 to 64-year-olds.
How about clusters in? I didn't mention that in terms of how you have to report clusters and what does that look like in the school system right now?
So with the clusters, within businesses, organizations, anything, if it's 5 or more cases within 14 days and they have to be linked together. So if it was in a school, just because they go to the same school doesn't mean they're going to be linked together. You know, if they're in the same classroom or if they're on the same team, that sort of thing, that would be linked. But just because one person's on one end of the school and the other one's on the other, they're not linked together. So that would not be a cluster unless they were by some chance. But that's what the clusters identified. Outbreak is a congregate living facility and it's 2 or more. So we would be looking at more of a cluster.
And we've had 0 of
And
those.
0 of those.
So you would say that the protocols, processes, the routines in the high schools, the one-way hallways, the bottle fillers that we have, you know, in the various schools, all of those have helped tremendously
Yes.
in our school system to keep us at the level where we are.
Everything that we have discussed as a group between health department and the school system coming together and our partnership that's been developed with this, I believe has helped tremendously. So anything that's come together and discussed, whether it be the hallways or the water fountains or anything in general, has helped with this.
And if there would be a cluster, you would notify Dr. Phipps
Oh,
immediately.
yes.
Okay, that's what you were talking about, that we could come back together in the event there was a cluster and have further discussion.
And just a cluster may not mean any particular thing has to happen, but we do have to acknowledge a cluster and we have to share that information and report it. But anything, even if it's not a cluster, if there's a trend that we're seeing or the data for us from a school perspective seems to change, or if we have even quarantines that are impacting our ability to operate, as Joe has said all along, we reserve the ability to come back and say, here's where we are and things have changed. And we hope if they change for the positive, but there's just no way to know what's going to happen a week or 2 down the road.
And with the clusters, you know, when we do contact tracing, when we call positives, and I'm very thankful that Robert and the nurses, they have their great team. So they're calling us in the EOC saying, hey, do you have this? We just want to make sure. So we automatically call them and start tracing and making sure we have everybody. But with that, once we know the schools and seeing if they're linked, we automatically, at that point, we would start looking at those trends, and then we would contact Dr. Phipps, we'd contact Robert to see kind of what we're looking at and our next steps. If there ever was a cluster, we would have to report it to the state at that point, but Dr. Phipps would know before we'd even report it to, I guess, our guy.
I think as Dr. Phipps pointed out, you know, the more potentially close to 400 more students coming back. I think going to what you said is where people are going to have to be more vigilant and their awareness not only in school but outside of school, because it looks as if most of the numbers are coming from outside of the school system themselves. Obviously, it affects the school system, but it didn't originate there. So I think the safety practices, not only within the school, but what you would do outside of the school are equally important.
That's something we definitely want to stress is when they go home, you know, make sure they're doing the 3 W's, just because if someone was to come into the school, we can take care of that, but what's going to happen when they leave, and is there going to be a spread within the school? So as long as we keep announcing that and having people do what they need to do, it should decrease the spread.
So as a key health professional, you would say that our move toward the K-5, Plan A is a reasonable progression.
With what I have presented, it's reasonable, but like Dr. Phipps mentioned, excuse me, that we may have tomorrow, things could change.
Yeah.
Going forward, it does look reasonable, but things could change in an instant. COVID, I feel like from the beginning, and I know Paige and Pam can mention too, that everything changes all the time with COVID. So that's something to think about as well. When he mentioned that it could change in an instant, that's the truth. So as of right now, it's reasonable, but it could definitely change by tomorrow.
So it's pretty obvious that cases are much fewer in the school than in the community. And maybe some of what we see is coming from external groups and gatherings and so forth.
That is
So
what
it's
we're
safe to
saying.
say that school is a safer places.
Almost, yeah. Sometimes, when we call people, and it's really hard sometimes for people to say exactly every place they've been or what's going on. And a lot of times they don't want to answer questions, but most of the time when it's dealing with school, they'll give you everything. And that's something that's not been answered lately. It's just been, I've been going here, I've been going there, but school's not been on the radar. It's been on outside places.
Well, we have certainly felt that safety and health were priority number one from the very beginning. And we still feel that way. And we understand the possibilities of what it could be in a couple of days or next week. And it might cause us to have to make an adjustment. But I don't know, what's the view of the board in regards to where we stand at this point in the plan with what Anna and Dr. Phipps has indicated?
I think the information we got, they're on track. But like you said, it could change tomorrow.
This board has had an opportunity to visit in 5 schools this week and at least that many before. And I'd like to thank Anna and the nurses and all of our administrators for taking seriously the information they've been given, because as we were out there, we saw what she has validated for us. And I'd also like to thank you, Ann, for working with the health department and for the community college and the others to help advise us and direct us and to tell you how important these partnerships are within our community, and for working as hard as we can to keep our students safely educated. So thank you.
I think we were all impressed going through the schools, seeing the protocols, the students wearing the masks, and the distancing,
And the routines.
the one-way calls, and just a lot of things going on that were of a very positive nature.
There's no need for a motion or anything unless there's a change of action. And I wanted to pull you together and just share with you what our current information is. You all have heard concerns from individuals on both sides, really across the continuum. And I wanted to lay out the data as we have it to share with you, knowing that we have this impending move coming up on Monday, to give you an opportunity if we felt like we needed to change course. And again, I want to reiterate what Joe has said. We want to be able to reserve the right to be able to call you back in and say, you know, this is something, and I felt like this was important. And the reason, just for the public knows, this is an emergency meeting, is that we didn't have 48 hours notice. And I felt like before the decision, before the move was made to Monday, I wanted to make sure everyone knew where we were at and what that number, what the data in the county really means when we look at it from a school system perspective.
I appreciate the numbers, and, you know, because I tried to write down the numbers that you gave us. That way, if a person, you know, and I understand the concern. I mean, I don't know of anybody on either side that doesn't have concerns. But if you've got actual numbers and facts, and this is what happened, it can help a person feel better. Because the county has to report the number, and that's good. But if you don't know where that number is coming from, it would be even more alarming. So I appreciate the numbers, and I appreciate you updating us on where we're at, and just giving us the facts as we have them today. And it's said, and it's said today, and it'll be said tomorrow, because it could change tomorrow and the next day. But thank you very much for the information.
Any other comments or questions? Anything else coming from the board? And we appreciate your being here tonight.
Thank you, Dr. I appreciate it.
Thank you.
Answering your questions. Yes. Any other comments? Any other questions? That being the case, do I hear a motion we adjourn?
Make a motion to adjourn.
Is there a second? Second. All those in favor say aye.
Um,
Any opposed? Motion passes. We are adjourned. Thank you for being here.